Now this brings us to India. Last night we told you how the Chinese subvariant had reached India. Tonight, I want to tell you how India plans to stay ahead of the game, how health officials in India are taking no chances. To start with, the Health Minister of India has said that quarantine structures may return along with mask mandates. This announcement came shortly after the Indian Prime Minister held a high-level review meeting to assess the situation. Present in the meeting was the CEO of Niti Aayog along with officials from the Ministry of Health and officials from the Home Affairs Ministry. And here's what the Health Minister of India said in Parliament shortly before the meeting began.
We're monitoring the situation. Changing variants and the risk they pose are under watch. Social awareness and monitoring increasingly being done. Genome sequencing is also being done. In view of the upcoming festive season, mask, hand wash, social distancing are some of the things that should be ensured. Random sampling at airports of those coming in from abroad has also started from today.
So what sort of guidelines is the centre expected to issue? We're awaiting a formal announcement for that. But what we have received are details of what the Prime Minister emphasised on during the meeting. To start with, he cautioned against complacency and advised officials to maintain strict vigil. Second, he emphasised the need for strengthened surveillance with a focus on genome sequencing and increased testing. Third, states have been advised to ensure operational readiness of hospital infrastructure. Fourth, the centre plans to ask people to adhere to COVID-appropriate behaviour, including wearing a mask. Yes, the mask advisory is back. Fifth, the Prime Minister stressed on a precautionary dose of vaccination for the elderly and vulnerable population groups. Now, these are just initial details. We're, of course, expecting an official statement on the guidelines from the Health Ministry. In the meantime, it helps to look at the COVID case tally in India. Remember, India's COVID numbers are currently at their lowest since the pandemic began. In fact, they have been on a steady decline for the last 5 months. According to the latest data, India has reported just 185 new cases in the last 24 hours, and besides these, there are just 3,402 active cases and no deaths have been reported since Wednesday. These active cases comprise 0.01% of the total infections, and if we speak of India's recovery rate, it stands at an impressive 98.80%. So what does this tell you? That India is not at risk, not yet. And it might not be. If we look at some factors, to start with, 96% of COVID vaccines given in India are either the Oxford AstraZeneca or Bharat Biotech's Covaxin. On the other hand, most of the vaccines given in China are indigenous vaccines like the CoronaVac or Sinopharm. We've said it before on the show, they're bogus vaccines. Countless studies have proven that Chinese vaccines are less effective than the ones given in India. CoronaVac offers 60% protection against the virus, while the Oxford AstraZeneca offers up to 76%. So that's one reason why India is currently at an advantage. The second reason is that a large share of the people in India has already been infected with COVID-19. You see, China's strict lockdowns have led to fewer people in the country building natural immunity to the virus. But that's not the case in India. Pan-India studies showed that the virus had 62% prevalence in India back in July in 2021. Since then, the figure has likely grown. In fact, 22% of infections in India has happened only since mid-December last year. That said, these figures shouldn't give way to complacency. Like I said, the virus is unpredictable, and yes, India may be currently at an advantage, but we still cannot afford to let our guard down. So I suggest that you put that mask on immediately. WION World is now available in your country. Download the app now and get all the news updates on the move.